What is hydralazine-induced lupus? Have you ever wondered how a medication can sometimes trigger unexpected health issues? Today, we are discussing hydralazine-induced lupus, a condition that can arise from the use of hydralazine, especially in emergency situations related to hypertension. Hydralazine is an antihypertensive medication that helps lower blood pressure by relaxing blood vessels. It is often used in cases of hypertensive crisis, where blood pressure rises dangerously high. While effective, prolonged use or higher doses can lead to an autoimmune response that resembles systemic lupus erythematosus. This is known as hydralazine-induced lupus. Patients who develop this condition may experience a range of symptoms. Common signs include joint pain and swelling, particularly in the hands and wrists. Muscle aches, fever, fatigue, and rashes can also occur. In some cases, more serious issues like inflammation of the lining around the lungs or heart may arise. Blood tests may reveal anemia or low white blood cell counts, indicating the body's immune system is reacting against itself. Diagnosing hydralazine-induced lupus involves looking at clinical symptoms and conducting laboratory tests. A significant marker is the presence of anti-nuclear antibodies, which are found in up to 90% of cases. Antihistone antibodies are also commonly associated with this condition. It is essential to rule out systemic lupus and confirm that the symptoms appeared after starting hydralazine. Certain factors can increase the risk of developing this condition. Higher daily doses, particularly those above 100 milligrams, and longer durations of use, typically exceeding 3 months, are significant contributors. Additionally, female patients and those with genetic predispositions may be more susceptible. However, even lower doses can sometimes lead to the syndrome. In the context of managing hypertension, hydralazine remains a useful option, particularly for hypertensive crises. However, it is vital for healthcare providers to monitor patients closely for any signs of lupus-like symptoms. Recognizing these symptoms early is important, as the condition is often reversible once hydralazine is discontinued. If a patient does develop hydralazine-induced lupus, the primary treatment is stopping the medication. Most symptoms will resolve after discontinuation. In more severe cases, such as those involving kidney inflammation, additional treatments like immunosuppressive therapy may be necessary. Early detection and management can help prevent serious complications. In summary, hydralazine-induced lupus is a drug-related autoimmune condition that can complicate the treatment of hypertension with hydralazine. Monitoring for symptoms and laboratory markers during therapy is essential for safe use of this medication.